This is our Vidant Spotlight, and in our Vidant Spotlight today, Dr. Nazreen Vora, who is a surgical oncologist and associate professor of surgery at ECU and Vidant. Did I get your name right?
You did.
Close enough?
Close enough.
All right, skin cancer. We're going to talk about skin cancer. It's a real problem for us, right? And look, when we were all kids, there weren't any sprays that we put on for sunscreen and that kind of. We didn't use that stuff.
Yep, that's right.
So it's really important, isn't it?
Absolutely, yes. 1 in 5 American will get skin cancer. So obviously, it's a very common problem.
Yeah.
And we need to do everything we can to prevent it, because prevention is better than cure, of course. So the greatest risk factor for skin cancer is damage from ultraviolet light. And so the key to remember is to apply sunscreen.
Yeah. Do you like the spray or the lotion, or does it matter?
I don't think it matters. There are 3 things to remember when you pick a sunscreen. One is, what kind of sun protection does it offer? So the American Academy of Dermatology recommends that the sunscreen at least be an SPF, which is a sun protection factor of 30, that it be water resistant, because as we know, they're not waterproof, but if you are in the water, you will need to reapply sunscreen more frequently. So it needs to be water resistant so it will last longer on your skin. And the third thing is that it needs to have a broad spectrum of protection, so that it protects you against both UVA and UVB type of ultraviolet light.
Now, there are different kinds of skin cancer, right? We hear about people who have really serious problems with it, and then you hear of people that just have to go over to the dermatologist office and have it clipped off. So are there different kinds?
Yes. Our skin is made up of many different cell types, and cancer is basically an uncontrolled growth of a cell. Depending on which cell type the cancer arises from, you can have a different type of skin cancer. For example, melanoma arises from skin cells called melanocytes, and it gives rise to melanoma. A squamous cell carcinoma arises from a different type of cell in the skin. So yes, there are many different types. The most common that we hear about are melanoma, squamous cell carcinoma, and basal cell carcinoma. And they have different risk factors, but they also have different prognosis, and their treatments can vary a little bit.
All right. What do we look for? I mean, we need to be checking ourselves, right?
Right. So one of the most important recommendations that the American Academy of Dermatology makes is for everybody, regardless of your risk, regardless of your age, is to perform a self-skin exam. And depending on what your self-skin exam shows, if you see something that is concerning or something that is changing, then you need to bring it to the attention of your primary care doctor. From there, your doctor can refer you to a dermatologist if necessary. So what are the things that you're looking for? The things that you look for are, if you may have heard the A, B, C, D, E's of melanoma. And so what you're looking for is a lesion or a growth on your skin that is asymmetric. Something that is very, very symmetric is unlikely to be cancer. It can still be a cancer, but it's unlikely. So something that is asymmetric, so A stands for asymmetry. B stands for borders. Again, is it irregular? Is it a very well circumscribed area? C stands for color. Or is it changing? So color meaning, is it pigmented? Is it darker? But not only is it dark, is it different levels of dark within that lesion? Because those are more concerning.
Gotcha.
D stands for diameter, or if it's greater than 6 millimeter, if you look at a pencil eraser, a back of a pencil, it's 6 millimeters. So anything greater than that is obviously concerning. Not that smaller lesions cannot be concerning, but certainly larger size, ulceration, abnormal appearance. And then E is evolving, which means, is it changing? If it's a cancer, cancers like to grow and change. So if something has been the same for 20 years, it's unlikely to be a problem. But something that is evolving and changing, you need to bring it to the attention of your physician.
Can kids get skin cancer?
Yes, kids can get skin cancer, especially children who are born with certain genes or genetic conditions that predispose them to cancer.
But the main thing with kids, right, is exposing them to the UV lights.
Right.
The kids out on the beach with their shirts off and not using sunscreen and stuff like that. It's a problem later in life, right?
Right. So you're right. So skin cancer is far less common in children than it is in adults because aging itself is a risk factor for skin cancer. However, kids can get skin cancer. So if you notice something on children that is abnormal, you need to bring it to the attention of your physician.
Dr. Nazreen Vora, who is a surgical oncologist and associate professor of surgery at the ECU Brody School of Medicine and Vidant Health, our guest here. We're talking about skin cancer as we get ready for another great summer here in eastern North Carolina. What happens if you get skin cancer? What kind of treatments are available?
So the treatments for skin cancer vary significantly, and it really depends on what type of skin cancer and what stage of skin cancer you have. So most people will have skin cancer that is in a very early stage or even a precancerous stage. And in those cases, a lot of times topical treatments or treatments with a minor procedure with a dermatologist will be all that you will need. If a skin cancer is advanced to the point that it has traveled to your lymph nodes or other parts of the body, then the treatment can vary, which it may require larger surgery, or it may require, in addition to surgery, other medications given in your IV, such as immunotherapy or targeted therapies, which are pills that you take. And those are prescribed by a cancer doctor called a medical oncologist.
Gotcha. And again, we're so fortunate to have Vidant Health and the Brody School of Medicine
Absolutely.
here. What resources are available locally here? What should people know about what can happen? What if they do have to have the need for medical care here for skin cancer?
Sure. So we have expertise both in surgical oncology, we have expertise in dermatology, dermatopathology, as well as medical oncology expertise. So we have, and radiation oncology. So we have experts who treat not only skin cancers, but we have experts within areas of skin cancer treatment that can help you with any of those modalities.
All right, great information. Anything I didn't ask you that you think people need to know?
I think it's most important to remember that the sun damage is cumulative, so it's important that children be protected from sun damage because, like you mentioned, as you the damage that you suffer as a child will impact your risk of skin cancer as an adult. So it's important to prevent skin cancer rather than treat it.
Thank you so much.
Absolutely.
I love these Vidant segments that we're fortunate to get the top doctors from Vidant Health and Brody in here. Thank you to Stan, also from the marketing department at Vidant, who's with, because this is great information.
Glad to be here.
Yeah, and we're so fortunate to have you and all the experts at Vidant Health here in our community.